The asbestos issue is not a thing of the past. It continues to this day.
We want to end this man-made disaster.
So let's ban asbestos.
So I'm going to kick off the first presentation. It's going to be short and sweet. The nice thing about this is no one really has to take any notes. We're going to put these videos online. You're able to share them and re-watch and do whatever you need to do to collectively move this information along. As you know, we're much more than banning asbestos. We really want to work with lawmakers, and we want to end this man-made disaster through education, advocacy, and community. It did start with two families, the Larkin and Reinstein families. It was my husband, Alan, who was just 63, who had that faint, persistent cough. Our daughter was just 10 at that time. I'd never heard of that horrible word, mesothelioma. I couldn't pronounce it, I couldn't spell it, and I didn't know what to do. I was in a rage. I needed to take care of my husband and my daughter, and I found myself paralyzed by isolation. So when I met Kim and Doug, and we all shared this idea, Alan and I all agreed that we would start an organization, and at that time we had no ideas. 10 years later, we would be doing this work. I am frustrated. There are far too many Michaels out there. We know that policy started grand in the 70s, and it has tapered off in these last 4 decades. The only thing going for asbestos awareness prevention in the United States is our resolutions. There are bills being drafted, there's some good progress being made, and dagnabbit if those, the other side of the aisle doesn't defeat nearly everything that we write. So there'll be an opportunity to join on some of the TSCA reform bills, and you'll hear more about that later on. It's so simple. These are the facts from the World Health Organization. 107,000 people die every year. What's wrong with us? Why are we still mining a killer dust? So there's international consensus. So we talk about taking knowledge and action to unite. We have the knowledge. We have international consensus. And it takes collaborative activism. It takes each of these groups, civil society, the private sector, and government, to truly come together to be the force that can reckon with the lawmakers. And we know statistics are people with the tears wiped away, as Professor Seligoff said, many of us in the aisles, in the audience. But how can you identify and manage risk? I ask you, do you know where asbestos might be in your home? I posed these 3 questions to Congress repeatedly. They sit very uncomfortably. They can't answer, and they know they're responsible. So ADAO made a penny slide, and you can see underneath President Lincoln's nose, there's 20,000 asbestos fibers compared to grains of rice in human hair. Again, how can you manage risk? So what we're trying to do at ADAO is take these facts and stats that we know, put them to picture form in infographics, and we have a new one outside. Ellen can show it to you later. And we share our infographics around the world so that they're easy to understand, and you can get the picture that the only way to prevent these diseases is obviously to eliminate exposure and find a cure. 10,000 Americans die every year. That's 30 a day. So we look at the types of exposure we have. We have these conversations repeatedly in Washington about consumer, environmental, and occupational. You can see Johnny's name at the bottom. I think that slide is important because it shows that this is a real threat to workers underneath the US Capitol, for example. Joplin, Missouri, because we imported 31 million tons of asbestos over the past 100+ years, we got a mess to clean up. And yes, Paul Ziegenbaum is in the audience. I don't see Paul because the lights are too strong. There you are. Paul brilliantly mastered an 18-month product testing campaign, and we did identify 5 products, and one was a child's toy with asbestos. You can see our consumption is still up to about 1,000 tons a year. And Celeste and I are working on another paper. We can't get the answers, and we can't get this to stop. And we import it to meet manufacturing needs. Do you know how that translates to Brazil when they're standing in the Supreme Courts and they reference the fact that the United States hasn't banned it and we're importing it? What does that say? Chrysotile is just a little bit carcinogenic? Must stop. So what are we going to do with knowledge and action? How are we going to move this forward? We know that with education, legislation, enforcement, we can end this. It'll take all 3. Well, how are we going to do it? it's through our stories. It's through the Michaels and Janelle and our quotes that we can take these stories to Congress, share with the media, share with you, that we can drive this message home. We can be the community that comes together using social media, but we're far greater than that. And I know the people here on Facebook are going to be nodding because we are sympathetic, caring, and connected. And it's not just some little tool and byproduct. We connect with our families. In fact, I got to see Damani for the first time last night. We're so proud. There's progress. When knowledge and action unite, look what we can do. This is our 10th resolution that the Senate passes unanimously for us. At the very bottom, you're going to see that there's a clause that they encourage or urge the Surgeon General to issue a warning. That doesn't come easy. We have to remind the office, follow through, be diligent and forceful. And we have gotten out of 7 resolutions that have urged them to issue a warning, we've had 3. And I guarantee you, we'll have them for the next year's forthcoming. We're not going to give up. So we're at day 5 of Global Asbestos Awareness Week. We have amazing content. Dr. Ken Takahashi had day 3, and Dr. Lemon and Frank, so I invite you to go to our website. It's another way for you to share information. These 3 statements can also be found online as we're sharing and educating others. We have legislative challenges I have never seen before. I am so frustrated. We've written amendments that have been in bills and they've been stripped out by the Republicans. I don't want to offend anybody who sits on, wants to think this is political, but this is the dance in Washington, D.C. We have the American Chemistry Council coming out in full force. They want to reform TSCA. It'll be TSCA light, and there will be no change. We know that we have the FACT Act that passed the House. What's that? It strips away civil rights for asbestos victims. We don't have a ban. We're still working on that. And we have regulatory violations, and Celeste, what are we going to do? I mean, it's beyond shaking your head. So at the end of the day, we know that we're taking our voices to Washington, and we're going to work in these 6 areas to make our voices louder and louder. We will not be silenced by power and greed. Our stories will continue, and our action is unrelenting. I promise you, Michael, I promise you. So there are going to be opportunities during the weekend to sign a declaration that we'll actually be publishing on the 7th. There is an action in Yale that I know Fernanda and Barry will speak about. There's a petition to protect civil rights. There's many opportunities over the weekend. So if it sounds confusing, don't let it be. If you believe in us and you believe in the cause, we need your signature and we need you on board. I found this quote a long time ago and it felt right to me. It says, out of the hottest fire comes the strongest steel. We have been galvanized together. And I know that together we are making change happen. So with that, Dr. Lemon is going to be the next presenter, and Dr. Oliver is going to come sit up at the table and moderate this session. And it will be an amazing medical session. So I look forward to hearing your questions. Please stop any of us during the weekend and enjoy the day. Thank you.